Right, fingers crossed, because a vaccine against COVID-19 really is critical to making Americans feel safe to return to school and work. But increasing numbers say that they are unlikely Americans to take the vaccine when it's developed. A lot of them anyway. CBS 46's special assignment reporter Sally Sears discovers public health officials' growing alarm. Sally.
Rick, I'm live at the CDC, where public health experts had been speaking very quietly, but now with much greater urgency, particularly here in Atlanta, saying a skeptical public toward taking a vaccine is a major risk to the public health of all of us. A vaccine is only as good as the people who take it, but public distrust of vaccines, some of it fed by social media falsehoods, is growing in the groups most at risk from the coronavirus, Hispanics and African Americans. Vaccination rates among those communities are lower for vaccines for other, even more deadly diseases like mumps, measles, and whooping cough.
People die of flu. Children die of flu, right? So we have to get the vaccines to help ourselves.
In an online interview, Atlanta pediatrician Hansa Bargava told me she is seeing terrible cases in her own practice.
A baby who was 3 weeks old who got pertussis because her 12-year-old sister was not vaccinated and she brought pertussis home to her. So these are the stories that move me as a pediatrician, but also as a mom.
Education. That's where public health experts say a change must come. And for those who fear the vaccine will actually transmit the virus, researchers say it will not because it is not alive. Genetic material from the coronavirus is injected into a weakened version of the common cold virus. That modified virus mimics COVID-19, kickstarting the immune system to attack if the real COVID does enter the body. So, as the race to develop the vaccine heats up, a second race begins. This one to convince the doubtful that taking it is important and they need to trust it. Sally Sears, live at the CDC, CBS 46 News.